Hi, Dr. Dorr just passed away last week, and there's a couple stories I want to tell because he was such a unique, magnanimous, amazing man who had such an impression on me, especially when I was a young medical student and surgeon, that to capture some of the essence of how he was, really is exemplified in some of the stories. So let me tell you the first one. The first surgery I ever did, I was ever involved in, was Dr. Dorr. I was doing research with him as like a first-year medical student, and he let me come into the operating room. And so it was like a total hip replacement. And I couldn't believe it. I mean, my dad was a surgeon, but I never even watched him operate. I had no experience. Everybody assumed I knew everything about surgery. I knew nothing. And so Dr. Dorr was my first experience. And I went into the operating room, and they're in the suits they look like astronauts in the suits and doing a total hip replacement. And I was just blown away. I could not believe the malleting and sawing the bone and drilling and slamming it in and blood kind of flying places in the air. I mean, it was just brutal. It was expertly brutal. I mean, it was a fine-tuned machine. It was like making a car. It was an assembly line. It was boom, 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 zoop, 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 boom, like pure mechanics, and it was amazing. And I was just blown away though because of the brutality of it, and yet at the same time the precision was just remarkable. And I had no idea what I was getting into. So he finishes the surgery, does the whole thing, and he finishes and he starts walking out of the room, and I'm standing there, trying not to be in the way and not bump into anything and be a fly on the wall. And he comes by and he just goes to pass by me. And so I said, well, that seemed to go pretty well. And Dr. Dorr goes, "They all do," and keeps walking right past me. And, it's just a classic Dorr. Like, they all do. He expected every surgery to go perfect, and they usually did. Same thing all the time, knock it out, be a champion in what you do. And, it was pretty remarkable. It was a shell shock experience at the same time. Something in me said, all right, well, I think I can do that. Let's at least give it a try. Another one, in doing research with him, research is difficult. You hit all these roadblocks, and I would just get stuck. I'd be like, well, this doesn't make sense. We're trying to categorize these hips into 3 different categories, but some of them don't fit, and I'm getting really confused, and I just don't think I can pull this research off. And that stops a lot of people from doing research because it's painful and it's grinding. And anytime I take it to Dr. Dorr, he would listen to my problem. I'd have to be pretty concise, try and sum it up, tell him what the problem was. He would look at it, and basically his answer was, well, you do this, and you keep going, and you make it happen, and you finish the problem. And it was one of those, that determination. I realized that a lot of times doing research, things aren't necessarily going to be perfect. But the point is, if you're going to finish a project, you just make it work. You figure it out and make it work and keep plowing ahead. And to me, Dr. Dorr was a great example of that energy and momentum of do not let things get in your way. You just keep plowing along, and the solution will arise. You just assume there is one and keep working until you find it. And he was great at finding them. He was great at finding the roadblocks and plowing right through them. And it reminds me of patients making rounds with him then when I was a resident and on his service. And, it was him and Ed McPherson and 60, 70 patients in the hospital, rounding at 5 in the morning on all these patients. I mean, it was crazy. And making rounds with Dr. Dorr, one of his techniques with patients, I mean, patients loved him. He took care of people. He loved them. He took care of them. They knew that he cared about them. Even though he was doing mass numbers and knocking everything out, he took the time to care about people and did it effectively and very efficiently. But occasionally you'd get somebody who was, not on board, not a real go-getter, and they were kind of laying in bed and malaise and, oh, this hurts and that hurts, and as a resident med student, they're kind of looking at you like, is something wrong? Is it supposed to hurt like this? And you don't know. I don't know. I haven't done enough of these. I don't know. Maybe you are dying and we should do something. Or maybe you'll be fine. I have no idea. But so Dr. Dorr, we tell Dr. Dorr, this patient's having a little bit of rough time and stuff like that. And Dorr would come in the room, and I called it the steamroller. Dorr would basically listen to him for a little bit, this and that. And Dorr would go, now look, you got nothing to worry about. I'm not worried, so you shouldn't be worried. If I'm worried, then you can worry. I'm not worried, so you're doing fine. Now get up and get moving. And, it worked. The patients literally would go, okay. And it was that confidence that it was like a very parental figure that they knew he cared about him. He was in control. He knew what was going on, and their job was to get out of bed. And so I called that the steamroller. I'm not worried. You shouldn't be worried. Move on. And it was a great technique. I try that with my kids occasionally, not quite as effective. And then, another one was just making rounds. Is every time we'd go on rounds, your job as the medical student or the resident, early resident, was to talk about the temperature and the vitals and stuff like that. And every time I'd say this patient has a temperature of 101.5, he'd go, I don't care about the temperature. Temperature in the first couple days after surgery means nothing. I don't care. Don't tell me about it. I don't want to hear about it. But then patients would have a temperature like 102, and I couldn't resist, of saying, hey, shouldn't I at least report it? And then you can ignore it if you want. And he'd always hammer me. Finally, I got him pretty good where I started figuring out how to read the physical therapy notes. And so I knew how far the patients were walking. So I started reporting that. Patient walked 50 feet. And I could tell he liked that because it wasn't really my job, but I was kind of, taking some initiative. Of course, it took me a little while to realize that the physical therapists were on rounds and I was stealing their report by saying it. It took me a little while to realize it. And that kind of relates to another one of what Dr. Dorr would say is basically your job is to do your job. And when we'd be operating, I'd always be trying to do too much, that I'd be trying to just do more, do as much as I could, and every once in a while, I'd kind of suck or my job was to suck and I might try and do a stitch or do something. And Dorr would go, just do your job. Everybody's got to do their job. You try and do too much, it messes the whole system up. Do your job and just worry about that. He had all these phrases he would just kind of yell out under his breath. And you go, okay, okay, I'll do my job. And so that was a great one. And then and ultimately, Dorr was just a master at bringing out the best in you. It was a challenging environment. And, you never really knew if you were doing good enough because you were always on edge and trying to make him happy and please him and don't make him upset. But he set that high level of bar of excellence that he expected the best out of everybody every day. And, that can be very challenging. And, especially like raising kids or trying to train people, it can put excessive demands on them. But at the same time, you knew that he cared about you, and the goal and the intention was to deliver the best care possible. It was like being in sports. You strive for perfection. You practice perfection. You drive for that. Now, if you don't achieve it, well, you learn to live with that, and you can make peace with it and say, well, we tried our best and we prepared, and you don't always get a perfect result. But you can still strive for perfection. And I'll tell you, other surgeons in the operating room who were nicer, they basically they would say, oh, please, and thank you, and stuff like that. And when people would hand him instruments, there was always a little bit of a delay. Well, with Dr. Dorr, there was no delay. He wouldn't even ask, put his hand out, instrument be in his hand. And he drove a hard ship, but he also brought out the best in people. And so it's interesting because he's from a past generation, whereas more of that military style of doing surgery and one person in charge, a man typically in charge and setting the tone. And so it's a balance now of how do you still do that? How do we all bring out the best in ourselves and expect the best with really high expectations, and at the same time still be human and allow forgiveness and acceptance and a role for everybody involved. And so it's a constant evolution. And I'm forever grateful for Dr. Dorr because he was a living example that I will have in me for the rest of my life about how to strive to be the best, how to care for people, how to love them, and how to bring out the best in everybody around you and in yourself. So I'm forever grateful and indebted and blessed that I had such an intimate contact with a man. Thank you.